Some things that you might do that are more effective, first thing would be to wake your client gently if they are asleep. Treat them as a person. Talk to them. Let them know it's mealtime. When you do try to get them to eat, you might need to cue them, which means say, pick your fork up, pick your spoon up. Now bring the spoon up to your mouth. You might even need to be saying, now chew your food. Sometimes you'll need to assist with what's called a hand-on-hand technique. And that is actually taking your hand, placing it over the client's hand, holding the spoon, putting the spoon into the food, and then bringing it up. Sometimes you'll do that 2 or 3 times, and then the client will be able to continue doing it themselves. Sometimes you'll have to do that the entire meal. That's still better than actually feeding the client themselves, because it is getting them to use their own muscles. If a client's clamping their mouth shut and seeming to not want to eat, there are several techniques that can be used. You can just say, open your mouth now, and see if that works. If not, you might stroke their cheek or stroke under their chin, and they might open their mouth that way. Never grab their mouth and force it open. Just gently stroke their cheek, and it might work. If that doesn't work, you might need to bring the spoon up to your client's lip. Frequently, once the spoon hits their lip, their mouth will open. If that doesn't work, if they've absolutely clamped their mouth shut, you are not going to force them to eat. But you might continue trying, or wait a few minutes and then come back and try those same techniques. Now sit back and watch and see if the caregiver does a better job this time.
Oh, Mrs. Smith. Mrs. Smith, wake up. Hi. Want to eat now? Here. Aw, come on. How was your visit from your daughter today? Was that good? Did she enjoy the stay? There you go. Those are good mashed potatoes. Here's another bite. Here, you can try it now. I'm going to help you. Hold on to it. Just bring it up to your mouth. Open your mouth. There you go. You got it. Here you go.
And the last problem that we'll be discussing is when a client has difficulty feeding themselves or inability to feed themselves. And this happens as the dementia progresses. Often a client might have trouble using their utensils. They might not remember how to use them, or they're unaware that they're even there. Another thing clients might do is just pick up an entire piece of meat or an entire roll and stick it in their mouth and try to chew. And this can be caused by a couple of things. One, if they've unsuccessfully been able to cut their food, they may just give up and say, I'll just eat it. Or not being aware of their utensils at all, they might just, well, this is how I eat. That could have been a very unsafe situation with the client putting the entire piece of meat in his mouth and trying to chew it. If the caregiver was not observant, the client could have been choking. Some techniques to use when a client's having difficulty in using utensils would be to just offer a spoon. Most foods can be eaten with a spoon, and if they only have one choice, they'll be able to use it. If a client is actually having physical difficulty holding the utensils, or if for some reason they can't bend their wrist or anything like that, you may need to get the occupational therapy department involved. The occupational therapists can provide what's called adaptive equipment. Sometimes they'll put tubes on the utensils, or a utensil might be bent so they don't have to bend their wrists. They have all sorts of equipment and techniques to have a client be able to feed themselves. That will be discussed a little further in another tape, but it's important to know that with trouble with utensils, there are ways around that to keep the client self-feeding. Again, if a client just cannot use a utensil or a cup, you may need to feed them. But prior to feeding, you should again try the hand-over-hand technique. Sometimes that is enough to get the client to feed themselves. You can do that with the utensils, as we explained before, or with a cup. You can actually physically place your client's hands on the cup. You put your hands over and bring the cup up to their mouth. Anytime you can get the client to be using their own muscles, it's much better, and it might just trigger their mind to, oh yes, this is what I'm supposed to be doing. Another thing that's very important is you need to be cutting up your client's food and making sure that they're safe. That way, if they pick a piece of food up and put it in their mouth, it won't be a large piece of meat, it would just be a tiny piece. As the caregiver, you need to be observing as much as possible to keep things safe, to keep your client able to feed themselves if possible, but if they're not able to feed themselves, that you're there to help them. Now watch and see what the caregiver does in this situation.
Hi, Mr. Jones. What are you doing there? I see you're having trouble cutting your meat. Here, let me help you. Let me help you. Here you go. I'll show you. Here. Here you go. There. Now you can take little bites.
Now we're going to discuss the caregiver's responsibilities in mealtime preparation for the dementia patient. Again, we've gone over this in the past, but it's worth repeating. You need to start with washing your hands. Tell the client that it's mealtime and what's being served. You probably will need to say not just that it's mealtime, but it's lunchtime, Mrs. Jones. And today we are having green beans, mashed potatoes, and roast chicken. And you might want to intersperse something like, doesn't that sound good? Or aren't you hungry? You need to try to get the client in the mood for eating. Then wash their hands, brush their teeth, take them to the bathroom. If they say they don't want to go, you may want to take them anyway, because frequently a client with dementia is not going to know. Make sure that their clothes are dry and that they're appropriately dressed. You would not want to be sitting in wet clothing while you're eating. So make sure that theirs are dry. Have the client seated in an upright position to prevent aspiration. Make sure that their chair back is straight. Place a clothes protector on them. Let them know what you're doing, and don't call it a bib. Using the word bib is kind of demeaning to them. And what you can say is, Mrs. Jones, could I put this clothes protector on you to keep your clothes clean? If a client does not want something going over their head, you can take it across their chest, but you do want to keep them covered up, because chances are they will be spilling. Make sure that they're going to receive the correct tray, and you do this by looking at the tray card and the client's name tag. With the dementia client, it's probably not best to rely on asking them what their name is, because many people will agree to whatever you say. If you say, "Are you Mrs. Jones?" they'll say yes. "Are you Mrs. Smith?" they'll say yes to that also. So you really do need to be looking at their name band until you